Yeah, so I think we have some people from University of Lagos, University of Ibadan. We have people from University of Calabar. We have, from Oyo. Really, really great. We had over 154 people put in application for this opportunity, right? And I'm really excited. For me, it's really more about, it's really more about the opportunity to interact and also to give back, right? Because this is a very, very important phase of I feel like your professional and basically also your career track, right? How you want to go. So it's really, really important that, we are able to give back and also guide, you on the process and the journey of, writing your research projects. Thank you. I think we had over 100 and I don't know if everyone has joined the call, but we had over 154 people put in application for these, and we have like 148 people, apply for the training. And it's very good because I just had the opportunity to interact with Etalk, and she was telling me she's just in the process of writing her own thesis, right? Our own final year thesis. You can open it here. Her own final year thesis. So it's really, really important that we are able to support this journey and also help you guys to do better work than we did in our own time. So yeah, so really excited to have you all here. So I think we are 1 minute to the time. For those who just joined, please feel free to use the chat box. Tell us where you're calling from. Oh, I see someone from Malawi. I see someone from, yeah, really, really great to have everyone join us today. So I'm going to quickly introduce myself so that I will be able to introduce the speaker for today, who is here. Okay, everyone's here. Yeah, perfect. So before I maybe introduce myself, and then I will allow everyone who is the program manager for this challenge to just speak and just introduce herself to the house. My name is Izine Asor. I'm really excited to have this opportunity to, do this programming to support, final year and undergrad students. About 6 years ago, yeah, 6 years to be precisely, I was in your shoes and I was, figuring out how I was going to write my own final year projects per se. And it was a very, very, it was very, very interesting process for me because I, just like many of you might find it, like a lot of us were just thrown into the weeds. We were in final year and we're told that we're going to have to write a final year project, right? That, aligns with our course. So for example, I was a pharmacy student, I was in pharmacy school, and we were required to write a final year project that is focused on, we're posted in different departments. I remember I was posted in, first of all, pharmaceutics, and then I was posted to pharmaceutics, right, to do my project. But I didn't really love pharmaceutics per se. I was not a pharmaceutics person. So I requested that I was moved to another department, right, for my final year project. And I was moved to clinical pharmacy. But even in the clinical pharmacy space, I kind of wondered, what can my research be focused on? Like literally, what am I going to be writing on, right? And I had a back and forth with my supervisor. I picked a topic, and then she gave me a topic. I started this project with my project partner, and after like 6 weeks of investing my time, my energy, realized that okay, this research might not work, right? This research is not relevant, first of all, and then this research is not, is not relevant to the population, right, in Africa, right? It was not relevant to Nigeria. It was not relevant. Nigeria, it wasn't relevant to our population. It was not what we needed, right? And I was doing a research that was done in America at the time, right? Australia and America were the two countries that had that research structure, right? They needed that kind of research. So, why we are doing this is also to help us to focus on what is needed in our population, right? What is the research that is relevant to not just our population, but also globally. And I am very impressed. I must say that I'm super impressed by the quality of research that we received through this challenge. I basically also supported the review, and I saw a lot of amazing projects, right? So, like I said, that was my why. I had a lot of back and forth with my project supervisor. I cried many times. I was insulted many times. That moment, I realized that okay, this is actually an opportunity to do great work. So back and forth, I was able to select another topic, and I started a new research project that is relevant. And I can tell you that the research project I did for my final year thesis is still very relevant, even in my career now, where I'm working. I always talk about it because it's still like the field I am currently working on, right? So I am a market access professional, and because of the research I did in my final year project, I've been able to get opportunities in spaces that, I never would have imagined. So while we're having this, is just to also pride you that even though you are doing a final year undergrad thesis, is very, very important. Another pain point I had, right, that was also very painful to me was, at the time also there was this picture that was trending. I don't know if you guys have seen this picture of where people would do final year research, they print it, they bind it, and it ends up in a dump, right? In a maybe trash. And I'm like, I remember that picture is still my why, because I remember I reached out to Yusuf and I told him that was like 2019. I was like, Yusuf, we need to do something about this. Like, people are spending time doing their final year project, and at the end of the year, it ends up in the trash. Nobody uses it. It doesn't, it's just a research you do, and then it doesn't add to the world, or it doesn't add to your population. And so we have this challenge today to really guide you and also help you to know how you can translate your research, your effort, your energy, your time into something that will actually impact the population and also globally, and also position you. Like I said, I also recently just wrapped up my MBA at Johns Hopkins University, and most of you know that Johns Hopkins is actually one of the best schools for healthcare globally. And in my interaction with a lot of undergrad students, I realized that these people were you see an undergrad student doing a research that actually would support, like, literally being used in the community, right? Being used in the real world, being used for a undergrad student doing research in cancer, doing research in digital health, doing a research that's actually very relevant. And so the purpose of this is also to prime you. And I just want to encourage you all. And I know that a couple of you might have attended a number of sessions, a number of, incubation hubs or things like that, or training or tech hub. But this is really not just about, getting your time. This is also positioning you for your career, for your business, whatever you want to do after school. I just want you to know that you've got us here, and I'm just one DM away. You can feel free to connect with me even after this. But I want you to focus. This is going to be a journey. Thank you for joining in this session. Before I hand off to our facilitator, I'll call on Able to introduce herself. I think she has done a lot of heavy lifting, and then she'll introduce herself. We'll introduce our guests. For those who just joined, please feel free to just drop on the chat box your name, where your school, your program, and also the country you're joining us from. Thank you. Ebon, over to you.
Thank you so much. All right. Thank you so much for joining. My name is Eboluwa Oluwayomi, and I'm a student from University of Ibadan. And my final year, I'm also a pharmacy student. So it's nice meeting you guys. I'm sure you've been seeing my emails, you've been seeing my name, and you're like, oh, who's this Ebon? So here am I. I just want to appreciate you guys. You guys did a good job in your application. That was really like wonderful thing. So I think you should just, appreciate yourself for having the grit and the passion to even put together your project and use it to apply for this kind of opportunity. And I really just want to encourage you that this training is a fully packed one. It's in 6 sessions, and we're also going to have the mentorship session. I'm sure you've gotten the schedule and all of that. Just ensure to be part of it. Don't miss any of it. We have one this week, another one, this one today, and that one tomorrow, then next week again. Just ensure to be a part and learn from the training and the speakers we are bringing. They are top notch global speakers, and you really don't want to miss that, especially if you want to take your research career serious. So I wish you all the best, and let's learn together and enjoy ourselves. Thank you.
Thank you so much, Ebon. And I feel like she's done a lot of heavy lifting supporting this. When I wanted to find out about what was happening, right? Because I know the pain I faced when I was doing my own project. I reached out to her to ask questions, and she was really, really, she's part of the team at HSB Global. I'm really, really glad to have her here. So without much ado, I would like to introduce our guests, our speaker and our facilitator for the day. I will probably just read her bio briefly. Probably some of you have already seen it. Miss Oluwatoyin has a pharmacy degree from the University of Ibadan, Nigeria, and a master's in international health management, economics, and policies from SDA Bocconi School of Management, Italy. She has supported healthcare researchers around the world through the publication process, specializing in manuscript editing, cover letter writing, addressing reviewers' comments, and providing detailed feedback on language and English grammar. During her master's program, she interned with Eli Lilly and Company, Italy Hub, where she contributed to real-world evidence research projects from ideation to implementation and publication. Oluwatoyin is committed to promoting evidence-based decision-making in medicine, and she appreciates opportunities to add value to younger colleagues through guidance and collaboration. So without much ado, I would like us with a virtual clap. Let's just welcome our guest. This is the very first session, and it's very, very important because it's the foundation of your research and publication, right? So for those of you who have started, right, who are still like figuring out, okay, what am I doing? Am I doing it right? How can I write a research or select a topic that, will be relevant in the world or in the future? Like I said, I worked with Merck, and during one of my sessions with my boss, I was just talking about the research I did while I was still an undergrad, right? And so this is a very, very important phase. So listen keenly and, let's join our hands together. Let's give a virtual clap as we welcome Fam Oluwatoyin. Toyin, over to you. Thank you.
Thank you so much, Ezinne. It's a real pleasure to be here. So for those of you that don't know, Ezinne and I were classmates from University of Ibadan. So it's really lovely to be here in this moment from those days trying to figure out what to do, how we're going to pass our exams, and now we're in different places doing really nice things. And it's a pleasure to be here. Thank you again, Nizim. It's lovely to be here. And thank you, everyone, as well. Thank you, everyone, for being here. And it's lovely to be here. Finally, I'm seeing people from Lagos, from Ibadan. I think I'm seeing people from Malawi as well, from Ghana, Maiduguri, Unimade, Kano. It's really lovely. It's nice. I'm saying hello to you from the city of Florence in Italy. It's lovely to be here, and I will go straight to. I'll share my slides now, and we'll start the process. Start the session.
So you can request. I'll give you sharing screen, right?
Okay. It says also disabled participant screen sharing. Perhaps she might. All right. Finally, can you all see my screen? Can you all see my screen?
It's coming up. It's coming up. I don't know whether it's my internet.
Yes, ma'am. You can see it.
Slideshow. Okay. Hold on, bear with me for a second. It worked just now. Okay. Can you see it in full screen now?
Yes, we can.
All right. Pardon?
Yes, we can see you.
Okay. All right. So today I've been asked to talk about the foundations of health research from idea to impact. And I'll try as much as possible to be concise as I can. So let's go straight to the point. The focus for today is the key learning outcomes for today is to help you all to understand how to link local health issues with the global health priorities, and in the end, choose impactful research topics. Are we all ready for that? Are we all? I know you guys, everyone is in final year, right?
Yes.
Can you hear?
Final year.
Yeah,
Yes.
it's in final year. All right. So feel free. I'd like us to interact and ask questions. To start, I'd like to highlight what Ezinne said earlier, that your final year project, it's not enough to just do the final year project and just the whole point is so that we can begin with the ending.
Yes, ma'am. We are all final year.
I think we missed her. I think she's no longer on the call, but I'm probably should join. She's having some internet challenges, so let's give her some minutes. Sorry, guys. Yeah, please, let's give her some minutes. I think she's having some internet challenges. Let me try and reach out to her. But for those who just joined, I think we just got started. This is the the meat of the research challenge. I know some people have been asking who are the winners. I mean, the winners of this challenge will definitely be announced on the final day of this training. That's the grant, right? But everybody here is a winner because if you're able to do great work, right? It's very, very important. And I just want to share that even before our guest comes back, even your final year research, right, can also help you if you are immigrating or you plan to do your master's degree, right? The quality of the research you've done, right, from your final year would help you when you're applying for even when you want to get your citizenship, right? These are things that nobody told us, right, when we're doing ours. And when you're doing your citizenship, you need to have like citations, research publications, and things like that. So the quality of the research you do right now can actually set the track for your career and set the track for your immigration, set the track of, because I'm currently now in the US with something called employment-based visa, right? And if you're applying for that, you actually need to submit a research publication that you've done, And so that's why we want to guide you on to be able to do relevant research that would, position you for your future, for your career, for your immigration, if that's what you want to do. And at the final day of this training, I'm committed to, providing you all with, what you can do, right? I feel like a lot of us probably, I'm still waiting for our guest to join. Going, please, if you are here, just come up. But probably some of you don't know that, there's even much more than just, traditional medicine or traditional pharmacy, right? Or traditional medical laboratory scientists. And probably some of you have been asking questions that what do I want to do after I graduate? What can I do? What can I achieve, right? It starts from, being curious. We hope that by the end of this research training, we not just only train you to be able to do great work for your final year research, but also position you on how you can begin to communicate the value you have as a healthcare professional. I'm always dazed by how the people in the developed world, people who are currently in the US, in Italy, like our colleague has said, we see their undergrad students, the confidence they have. It's actually I don't know how to put it. It's actually very, very interesting how confident they are to speak to their work or to speak to certain topics like cancer. You feel like they're grad student or they're master student. And my hope is that by the end of this training, everybody on this call, right, will be able to speak that same language, right, in positioning themselves.
All right. So let's talk about malaria research and how Uganda's local researchers impacted global research. So, for example, what happened was that Uganda is a very high malaria endemic country, just like Nigeria, some other African countries. So, based on this high malaria transmission, especially in rural areas, the local researchers decided to do like community-based interventions. So they started training people like village health teams to distribute insecticide-treated nets, and they educated families on proper net usage. They also used those village health teams to not only train people for using treated nets, they also trained them to monitor and report cases. So they were also involved in surveillance. So all of this was like a package of malaria, sort of like how to combat malaria in the country. And based on this success, they realized that this is actually working. Like in villages that had this had this kind of intervention, they realized that malaria cases were reducing, and provided insights that translated to the rollback malaria program that started in 1997. And this same success continues to influence the WHO's global technical strategy for malaria, especially the one of 2016 to 2030. And this is an example of how something that people just start in their community can eventually influence what happens in the global space. So another example is what happened with HIV/AIDS in Botswana. Can you all hear me?
Yes, we can hear you.
All right,
Yes,
great.
please.
The slide is up now. Can you see?
Nice. All right. So let's go to the next slide. Thank you, isn't it? So another thing that happened is with Botswana. In Botswana, there was this issue of there was a program that they did, like a combination prevention progress project, in which they decided to expand HIV testing and counseling. in certain communities. And then they, in those same communities, apart from expanding testing, they also initiated treatment for everyone who tested positive, regardless of their CD4 count. And they encouraged male circumcision, and they also mobilized, they also worked in terms of health education to reduce stigma. And the impact of this was reported in papers and influenced what is now being done in the global landscape in test and treat, in WHO's guidelines, in UNAIDS guidelines, and in PEPFAR guidelines. So all of this is just to tell you that when you are trying to do your research, when you are thinking of your project, try to think of something, think of what can happen, like what starts here can change the world, what starts in your community can change the world. So let's go to the next slide. Let's start from global priorities. So again, today the concepts that we're looking at is how to gain insight from global priorities to do your own local research in your community. All right, Isn't it? Can we move to the next slide, please? All right. So in general, how many of us know about the SDGs, the Sustainable Development Goals? If you know, you can just raise your hand in the chat. Yeah, I can see from Sarah. Yeah. So I think a couple of us, SDG is not a new thing right now. Yeah, Olamide. Yeah, great. All right. So we know that which goal is for health, for global health. Does anyone know? You all know. Goal 3. Yeah, perfect. So goal 3 is for health. Goal 4 is education. Goal 3, apart from, it's not just, let's just improve health and well-being. There are a lot of targets and indicators from all in this single goal. So the world is trying to reduce maternal mortality. They are trying to reduce preventable deaths. They are trying to reduce infant mortality. The world is trying to fight communicable diseases like malaria and HIV, like I mentioned. They are trying to also reduce injuries and deaths from road traffic accidents. They are trying to improve healthcare financing. They're trying to improve health coverage to ensure that that everybody all over the world, no matter what regardless of their postal code, has access to quality healthcare. And a lot has been done, starting from 2015 when these goals were formulated and agreed upon, up until to 2030. And I'm sure that by 2030, there will be another rollout. They might call it a new name, because before SDGs, there were MDGs. The bottom line is that the world is interested in improving the health of their communities. So you should always bear that in mind. And how can we find what is actually the hot topics? Just go online and check what are the global health, what are the Sustainable Development Goals, Goal 3, or you can check the WHO health framework. You can also check your countries if you don't want to go. You want to actually narrow things down to your country's focus as well. You can check your country's sort of like guidelines. You can always check. There's always, and these documents are always online openly to see what are the issues, the societal issues that are being combated. So let's go to local health priorities now, local health issues. So local health issues, we have talked about, starting from the global priorities, that this is what we're trying to achieve globally. We can narrow it down to what is happening in our own communities. What is actually the main problem? Because, for example, Italy, they are not thinking of malaria here. If I say, if you're trying to combat malaria and use insecticide-treated nets, it doesn't apply here. They don't even know. If you test positive for malaria here, they are not even familiar with the symptoms. But on the other hand, smoking is a very big deal. So the health issues, the focus of the WHO in this country is definitely not malaria. But in Africa, for example, in Uganda, in Nigeria, they're trying to focus on malaria. Here, let me talk about another example is, let's talk about reproduction. The priority of the government is to improve fertility. They are begging the people in the West, in Europe, to give birth. But in Africa, they are trying to stop people from giving birth. So you can see different communities have their own issues, their own local health issues. So and as I see that everyone on the field, we call are Africans. Everyone here is an African. So we have people from mostly Nigerians. I see people also from Malawi and Ghana. So we all have similar stories, one way or the other. But again, we still need to focus on pressing issues in our own specific communities or in whatever community that you are trying to do your research in. So for example, in Guinea, if we look at the issues of maternal and neonatal mortality, what they are doing is, for example, there's like limited skilled birth attendants. There's also a high maternal death rate, which applies in other African countries as well. In Kenya, if you look at the issue of mental health stigma, the major local health issues are that people they don't have access to mental health services. They also don't have access. We also see interest in youth-led initiatives that are trying to integrate mental health services into the routine medical care. Another example is in Ethiopia, which they are having issues with their universal health coverage. So starting from global health issues, we can find a way to link what the World Bank or the WHO or UNICEF is trying to do to what we need in our own society. So let's move to the next slide. All right. So in bearing this in mind, let's start on what can we do? Like how can you initiate as a, for example, final year pharmacy students, you have been posted to clinical pharmacy, you're trying to do your final year research, and you want to do something of global health relevance. Start broad. Start by thinking, okay, for example, check on the different, go online and check what are the goal 3. Read extensively about goal 3 and look at what piques your interest. So for example, let's say what piques my interest is mental health issue, which is, I think the 4th or 3rd target of goal 3 is about how to improve the mental health of people. For example, you can look at mental health of adolescents. Then to narrow it down, but before narrowing it down, one major thing about research is that you are trying to add new knowledge. Your research is most impactful if you are actually filling a gap in knowledge, not like you are not repeating what someone else has done. So that is why they ask you to do literature review. They ask people to do literature reviews to know that, okay, this is what has been done. This is what we know about mental health issues in adolescents. And then we can now say, okay, this is what we don't know. So for example, we know that people of adolescent age, we understand that they deal with, for example, self-esteem issues, peer pressure. But we also know that they have started to use, this is the area of social media, and but maybe in certain communities, social media has not been linked to teenage anxiety. And now you are interested in in exploring that aspect for your community. So you narrow that focus and you specify what's the population. So for example, you can say not only social media, you can say what social media do I want to use? Do I want to focus on whether Instagram or Facebook or TikTok, which is now TikTok is now, how many of you are on TikTok? If you're on TikTok, let me see your hands. Hello. All right. Yeah, that's Mary Blessing. You guys, you're online. You're in vogue. Let me say that. All right. So for example, you might want to see that, check what is the link between Instagram use or TikTok use in girls aged 13 to 19. So that's the question. Yeah, I can see you. Thank you guys. So for example, we have started broad. The broad issue is mental health in adolescents. And the specific focus now is, for example, let's say in Abuja, let's pick maybe Ibadan. We want to look at how Instagram use is related to anxiety among girls, secondary school girls, high school girls, aged 13 to maybe 16 or 19, Ibadan. So that can be your research question. And then you can move to that because every research must have a question. And your question must be open-ended. It cannot be a question with a yes or no answer. It must be open-ended and it must be like smart. I would explain better on what to focus on in your research question in the next slide. So, for example, can I say, how does daily Instagram use affect anxiety levels in teenage girls aged 13 to 18 or 13 to 19? And make sure that your question, your research question is clear, is focused, it's specific, and it's relevant to what's going on in your community. Remember, your aim is to do something with impact. Maybe not immediate impact, or with impact, whether you can see the impact now or in the future, but not something that you just do, get the grades, and then they'll just keep it on the shelf. Another examples of research question formats can be that you want to check what is the impact of, for example, in this case, Instagram use on anxiety in teenage girls. Another thing is, how does, for example, if we want to look at maybe the issue of drug abuse, we can say, how does drug abuse influence academic excellence in adolescents? I hope you get my point. So you can say, to what extent, for example, let's say we want to look at the issue of access to clean water and sanitation, on reduction of communicable diseases, infectious diseases. So we can say, to what extent does access to clean water and sanitation impact disease transmission in a certain community, or why does so and so, something like that. So let's move to the next slide. So when you are framing your research question, there is one thing that I would like you to bear in mind. It's called the PICO model. It's a thing in epidemiology, whereby it's a frame whereby we are trying to help, well, the people who formulated PICO are trying to help researchers to have focused and answerable research questions, epidemiological questions that are focused and that can be answered, because we don't want to waste money, we don't want to waste time. We want to actually do research that answers relevant questions. Continuing on the issue of that teenage girls and Instagram use and all of that. So PICO is an acronym, and P means or the problem or the population. So it's like your population, the population that we are looking at. So in this case, the population is teenage girls. I means intervention. So what exactly are we, like, what is the intervention, or maybe the exposure in another situation? If you are not looking at, for example, it can be called intervention or exposure. So the exposure here, or the intervention here, is daily Instagram use. And then C stands for comparison or control. So that's like, what is the alternative to the intervention? So you're either using Instagram daily, or you're using it, or you're not using it at all, or you're using it in a limited to a limited extent. So in this case, if this research, they are going to conduct this research, they probably say no Instagram use versus no Instagram use, or limited Instagram use can be like using Instagram maybe 3 times a week, or maybe 2 times a week, versus those that use Instagram every single day. And the outcome of interest is the anxiety level. So the outcome of interest is what we're actually looking for, like what we are trying to, like, what is the impact that we are looking at. So in this case, the P is patients. The P is the patient or the problem, and the population here is teenage girls. It's anxiety. The intervention is daily Instagram use. The comparison or the control is no Instagram use, and outcome of interest is the anxiety levels, or change in anxiety levels. So bearing that in mind, I hope we all understand. I mean, are you all following? Am I clear enough? Because I would like us to do some exercise together. Are you all with me?
Yes.
We're together, man.
Go to the next slide.
Yeah, on the next slide, can you
Alright.
see?
I want us to do an exercise together. Pick a global health priority. Narrow it down to what is happening in your community, and then let's create a research question from that. I want us, it's not enough that we are just theory and then let's do practice. I'm sure I've checked I checked the brochure. Colleagues will talk about, by next week, the colleagues will talk about how to do your research methodology, how to check your statistics and all of that. So today the focus is on research question, is on how to start, like the starting point. how to create your research question. So are we ready?
Yes,
ma'am.
All right. So I want us to talk on the chat, or if you want, you can also raise your hand and then you can unmute your mic and then we can talk. Let's move to the next slide. I would actually like to type. I think I'm going to type whatever I will fill this table. I want us to fill this table. The first one, I already filled the first one. As you can see, I've been talking about maternal mortality a lot because it's something that I do like. I don't like maternal mortality. You understand what I'm saying? It's a subject that I care about. So let's say the global health priority in this situation is to reduce maternal mortality, which is the first target of healthcare of the SDG 3. And then the local issue that I'm probably trying to look at is why are mothers dying from childbirth in, for example, let's say Biu community in Borno State, or in maybe Ojuelegba in Lagos State, or in some other, let's just say some certain communities, whether rural or urban. So the research question can be that, okay, we're looking at different factors, actually, of all the factors that can contribute to high maternal mortality. For example, it could be maybe low health seeking behaviors, that women are not going to the hospital when they're pregnant. Or number two, it could be that there's even no hospital to go to because there's no access. Or number three, they cannot afford it. There's no financing. But in this case, another one is birth attendants, like what is happening when these women are giving birth? Who are the people? Who are the midwives? Like who are the people actually attending to them during their during the process of parturition? So how trained are they? So we can say that how the structured midwife training programs compared to the standard midwife practice. So those would just go with the flow. They do what they don't have any formal training. They just do what they have been doing traditionally. Like how does that affect maternal and neonatal health outcomes? So in that case, the P here is the rural community. The I is the structured midwife training, the intervention. And the outcome is the status quo, that in general, people have just been doing their own thing without formal training. And their outcome of interest is maternal and neonatal health outcome. So who wants to try? Who wants to try?
Yes, ma. I want to try.
Yes, let's do this.
Yes, ma.
Yeah.
Can you hear me?
Yes, tell me.
Can you all hear me, please?
Yes, we can hear you. Go
Yes, I
ahead.
can hear you loud and clear.
Okay. My name is Anas Al-Qasim. I'm a final year student from Bayero University, Kano, in Nigeria, studying medical laboratory science.
Okay.
So the global issue which I want to talk about is hepatitis B virus.
Okay, so that's part of infectious diseases in general. Infectious diseases with a focus on. I'm typing on my computer. I will show you the thing later. I will share my screen or have them send it to everyone if possible. Is it possible to send them these slides? Go ahead, Anas. All right, I'm listening.
I think his internet. He's speaking, boy. His internet is like, I can see his. Anas, you mind? Maybe you should switch off your video and just speak, because I feel like.
So the issue is hepatitis B virus infection, which is an infectious disease.
Yeah.
Yeah. Yes, ma. And it's of endemic globally. So most of those who are living in boarding school are usually having this type of virus infection. So there is one research which I am on it, and all about this hepatitis B virus infection among boarding schools and day school students within Kano State.
Okay.
So I was thinking that maybe there may be a variability between those students living in boarding school and those.
That's an interesting topic, though.
I don't think we can hear you, Anas. Anas, maybe you can drop it on the chat box, and anybody else who wants to speak to. Yes. Tonya, are you able to share your screen?
It still says I'm disabled from sharing the screen. Okay, let me try now.
So is there anybody else willing to share with us what they have taught you? Or you could use your project. I mean, this is an opportunity for you to also get clarity and guidance. If I were you, I would just speak up.
Absolutely. Okay. I can share the screen. Oh,
Yes, we can see. Brenda, you want to speak? Yes, you can go ahead, Brenda.
Hello, can you hear me?
Yes, we can hear you, Brenda.
Okay, so the global issue I have picked is malaria.
Okay.
Hello?
okay.
Yeah, and in narrowing it down in my community is that a lot of people tend to use net for fishing. And the second question is that how is fishing impact malaria infection? How is fishing impact malaria infection? That's one research question.
Okay, so more like people using insecticide-treated nets to fish instead of using it
Yes.
to protect themselves from mosquito bites. So we
Yes.
can look into fishing, like, for example, compare communities who fish versus communities who don't fish. And that way we can see maybe in communities who don't fish, the effectiveness of the insecticide-treated nets can be seen better than in those people who fish, than in communities where they fish it regularly. Is that right?
Yes.
Yeah, I think it's, yeah. So in this case now, the global health priority is infectious diseases, malaria, and the local health issue is fishing and malaria transmission.
All right.
And malaria transmission, right? Or malaria prevalence. So in that case, let's try to frame a research question. So the research question can be, like you said, how does fishing, it's interesting though, if you think about it, how can fish, let's say people in the West, when they think about fishing and malaria, if you don't look at it, if you don't understand what's happening in the local space, in the environment, you might not be able to understand that fishing can actually increase malaria prevalence, because people, instead of using insecticide-treated nets for what they should, for the real purpose, they are using it to fish. So we can say, how does fishing impact or influence malaria transmission or prevalence in certain communities? Nice. That's really interesting. That's good. So in this case, the population of interest is the communities that we're looking at. The impact, the intervention is fishing. The control is non-fishing, sort of like communities where they don't fish. And the outcome of interest is malaria prevalence or malaria transmission. Do you guys understand? Do you get, am I clear enough?
Yes, please.
Yeah.
All right. Anyone else wants to share? Thank you, Brenda. Where are you from?
I'm not sure we heard you, Brenda. What country are you from? I think Anita also wants to try.
Yeah, I've seen Anita. Okay.
I'm from
Malawi.
Malawi. Nice. I had a friend from Malawi. His name's John Ponda. And I think of Malawi. He's also into health research. Lovely. Thank you for your contribution. All right, Anita.
Hello, my name is Anita. Please, I want to use my project to try.
Yeah.
My project is on HIV.
Okay. All right.
So for the local issue, the preventive strategy is like where the problem is the younger people around don't want to use condoms. They don't want to use like condoms, the dermal dams, and the preventive strategies that can reduce the spread. So for my local issues is like the high HIV rates among the Hohoi people in Ghana.
Okay. So
because they don't use their preventive strategies. Please, am I right?
Yeah. So you mean like young people in general?
Yes, please. The age bracket 15 to 24.
And with non-usage?
Yes, please.
Or let's say the practice of unprotected sex.
Yes,
so
please.
Unprotected sex among young people, like among
young people. Yes, please.
Okay. Young people and HIV transmission rates, right? So
my research question is, how does unprotected sex affect the transmission? Please, am I on the right track?
Yeah, actually, you are right. So what we're looking at is the impact or the relationship between prevalent unprotected sex among young people and HIV transmission rates or HIV rates.
Yes,
I think it's simple, straight to the point. And it's really, you're right. Have you started the project already?
Yes, please.
Nice. You let us know how the exact, I mean, we usually we know what is going to happen. That a lot of unprotected sex means high HIV transmission rates, but it is always more insightful when you do the research and you actually get the numbers. So that way we are not only guessing or just saying this is what it might be, but we actually have the data to back it up. And this is one of the things that I think if you do this kind of research, this is kind of research that influence global plans, global health
Absolutely.
plans, national, lead to perhaps interventions and maybe eventually, interventions like increasing awareness, increasing access to protection, and so many other things. So kudos.
Yeah, if I may chime in here too, I also think that this is a very, very interesting research because you all know what is happening right now in the HIV space, right? And
Yes,
maybe
please.
as time is going on through this research, you learn how to be confident enough to walk into some of these global health research that are focused on HIV. I tell them, I have a research on HIV/AIDS. I feel like this is important. You can write an article about it. You will learn more about it, but great research topic, actually very relevant in this time where HIV is facing a lot of backlash, not just in Nigeria, all over Africa and globally. So this is the purpose of why we are having this, to be able to help you know how best to position your research work. It's not just a final year research, it's a research that can go global. Thank you for sharing. Over to you, Tony.
You're welcome.
Thank you so much. Okay, I think we finish at 6, right?
Yes, we are actually meant to wrap up in 1 hour, but I feel like how many people hands are raised?
Yeah, I'm
Is
seeing
this
so
your
many.
is this your last slide?
Yeah, this is actually the last slide.
But let's just quickly do like a 1 minute for each of them.
Yeah, let's do one more and then we wrap things up. I can see Aminu's hands has been up since. Manasseh and Benjamin, I'm afraid we might have to. I think if you cannot speak, you can type on the chat. Let's do that. While Aminu is writing, is speaking, Benjamin and Manasseh can type on the chat. Please bear with us. All right, Aminu, over to you.
All right, thank you very much. Good evening, everyone. Thank you for the presentation. My research is it's the evaluation of serum uric acid levels amongst malaria-infected pregnant women here in Kano State, Nigeria. So the global health priority is, of course, infectious diseases, malaria.
I can hear you clearly.
All right. Did you get the title of the research project?
No. Can you repeat yourself?
It's evaluation of serum uric acid levels in malaria-infected pregnant women here in Kano State, Nigeria.
Okay, serum uric acid.
Okay.
Serum uric acid levels and malaria-infected
Women, yes.
pregnant women.
Yes.
Infected pregnant in Kano State. All right. So the global health issue is malaria.
Yes, ma'am.
Right. So it's still infectious disease. So I want to see someone talking about infections. Is anyone working on that? So the local issue now, can you tell us more? So what's the local issue?
So the local issue here is most of the pregnant women attending specific antenatal clinics here, although they are aware of malaria, but most of them do not adhere to the best practices to prevent malaria. So they are most likely unaware of the best practices.
Yeah. So say ignorant. Well, more like ignorance of best practices for malaria prevention among pregnant women. All right. Can I ask why serum uric acid is being checked?
Yes, ma.
Yeah.
All right. Mostly in the past, pathological diagnosis is mostly depended on when it comes to laboratory diagnosis. But this uric acid levels, it tends to define the extent of severity as a biomarker on its own. So it tends to define the severity of malaria infection, especially during the 2nd to 3rd trimester, because of oxidative stress, which tends to stimulate the response, physiological response, leading to spike in serum uric acid levels.
That's nice. Okay. So, all right. So, of course, now the serum uric acid levels now is like a surrogate endpoint in that sense. So it's a biomarker to let us know that the body is fighting something. is fighting so among malaria-infected women, there is increased oxidative stress, and in turn, there's increased uric acid levels in the serum, right?
Yes, ma'am.
So in that case, nice. The population, if you want to go by the PICO model, population is pregnant women in Kano State. The intervention that we're looking at now, the intervention will be, let's say, malaria infection. Then the control is people without malaria infection. And the outcome of interest, which is like the surrogate endpoint, is the serum uric acid levels, right?
Yes, ma'am.
All right. Yeah, you have done a lot. So has anyone else written in the slide, in the chat? All right, I can see this is something about improper disposal. All right, I have to wrap up, but I'm going to copy. Climate change and its impacts on healthcare delivery. Nice. I wish you could explore that.
My God, this is actually I'm super impressed. Whoever dropped that climate change, we need to talk. We need to talk. Thank you so much, Toyin. I feel like there are a lot of great research. I'm seeing fertility. I'm seeing topic on, pharmaceutical waste. I'm seeing a topic on cancer. I'm seeing a topic on maternal and child health. Great job, everybody. I'm sure that before we end this session, you are going to be, I can promise you that you are going to be positioned for global health, right? That's the promise I'm making to you. Whether you win the grant or not, you're going to be positioned for global health. So over to you back, Toyin, if you want to wrap up.
All right. Yeah, I would like to wrap up because I have an engagement in a few minutes now. It's Friday. I'm not missing my Friday night. All right. So, what I'm going to do is I will copy and sort of like create a table. I will include everything on this, all the things that have been mentioned on the chart. So someone's talking about, someone asked, does PICO apply to all issues? Most. And in some cases, it's not necessarily an intervention like you are the one, like the researchers are the ones introducing the intervention. It's more like instead of intervention, exposure. So for example, like the one we just talked about now, malaria in uric acid levels. The malaria is not necessarily it's an exposure in that sense. So PICO is applicable in most issues in healthcare and especially epidemiological research. It's just a guideline to be able to.
Oh my God, I think we lost our speaker. Toyin, are you still here? Probably she has internet issues, but how many of us enjoyed the session today? If you feel it was relevant, can you just thumbs up or drop something on the chat box? Okay, someone has a question. Manasseh, please just quickly. I think we'll wrap up in 5 minutes. Let's end this because I know a lot of people have.
Hello, can you hear me?
Yes, we can.
Yeah, thank you so much. As you've already mentioned, my name is Manasseh Alintruisa from Federal University Maiduguri in Nigeria, as northern part of Nigeria precisely. I literally have a big question to ask, but coupled with the fact that we don't have so much time, I have to just make it short so we can round up. And maybe in our next meeting, I'm surely going to ask my question because it really has to be discussed.
Okay, perfect.
Yeah, the question I want to ask right now is seriously about the PICO dimension. I just arrived when they were talking about PICO model of something, which I couldn't get it because I was literally battling with network issues, so I couldn't understand what exactly they're talking about. So please, I don't know if they are going to share let me just say the slide after the meeting or something.
Yes, you will get the slide and also the recording will be uploaded for you to be able to go back and listen. But yeah, thank you for joining. So, if we felt this was relevant, I feel like this is something that I wish somebody had back then when I was doing my own research. Somebody had guided me and told me, because it's one thing just doing. I don't want it to be like you guys just do a research and then it ends there, right? Somebody shelves up the file, right? I want you to prime your mind that you can actually do great work that will be relevant for your field and your career. I think I saw somebody said his research led to him starting a startup, right? That's the idea, right? Your research can also lead you to speaking in global conferences, traveling to Spain, traveling to Italy to go and present, because a lot of people do not do. You know why I started? Let me tell you a bit story before we go ahead. The reason why I started HSB Global, right, which is a healthcare consultancy firm, was really because people don't even know anything about the African markets. Like, you'll be shocked that people who are professors of global health, they don't even know anything about the African market. You guys are the experts, right? That would tell people, okay, this is what is happening in cancer. This is what's happening in pharmaceutical space. This is what's happening in pharmacognosy. That's the confidence I want to infuse in everyone on this call and everyone who has joined this challenge, that wherever you find yourself, you say, I'm an expert in cancer research. I'm an expert in pharmaceutical research. And some people might go on, to launch a product, launch a startup, launch a digital solution from just their research. So I hope this was helpful. I encourage us to take time. I think Ebon will share the slide with everyone and also the recording, to take time to just, listen into it again, think about it, and see how you can maybe tweak your current research project. Also think about how you can take your research project globally. So thank you so much for joining. I don't know if Tony is back. But this was a very helpful, I enjoyed it myself. I learned so much myself. So like we said, this is the first of, we have 5 more sessions to go. And I'm very confident that before the end of this session, there is going to be an opportunity for you to have a career insight, right? There's someone we've invited. She's the best in the world, right? In terms of like scientific writing. And she's going to be coming because he's someone that speaks all over the world. She's going to be coming to teach us how we can become, custodians of the area of research we have chosen, right? And taking it forward in our different careers and everything we do. So if you've enjoyed today's session, please tell your friend, don't miss it. I think it's part of the criteria. We already have a couple of people we have already said are going to, we've already reviewed what we want to see, because we can't just hand you the grants if we are not trained, if we don't know how to do great work. And so that's why we are having this session. So thank you so much for joining, and I hope that everyone has the best of the rest of the day. Toyin, I don't know if she's back, but thank you, Toyin, for giving us your time and joining this session. I know she's very busy. She's all the way from Italy. She attended the best, School of Management in Italy. We're bringing the best. Then we have someone from Harvard come to train us, have Public School of Public Health. Someone from Johns Hopkins will also be coming to train us. So you guys have, this is something I wish I had. So I hope that you maximize this opportunity. Tell your classmates, even though they didn't apply for the grant, to join this session, because it will be helpful for all of them. Thank you. Yeah, somebody said, are we marking attendance? No, once you register on the Zoom, you have those who have registered, who joined the session. So thank you for joining, and have a great rest of the day. Have a great one, everyone. Bye.
Thank you. Please don't forget tomorrow's session. Bye.
Yeah, please don't forget tomorrow's session. So yes.
Okay, bye.
Bye.